Hi there, I'm Heather Doidge-Sidhu, one of the service providers at the Mood Disorders Association. I'm a registered clinical counselor with my master's degree in counseling psychology. And I'm here today to tell you about cognitive behavior therapy. So cognitive behavior therapy, or CBT as it's more commonly referred to, is an interesting blend of some modern mental health theory, that's the cognitive part, the focus on thoughts, and some older, more original mental health theory, and that's the behavior part. So this two-pronged approach to symptom relief and wellness has a ton of excellent evidence backing and supporting its use for mental health issues, in particular anxiety and depression. So CBT is an approach to counseling that stresses the importance of our beliefs when it comes to mental health and wellness. These beliefs, often referred to as core beliefs, may not even be something we're aware of. We might think a certain negative way and not even really know that we're doing it. Whether we're conscious of them or not, core beliefs can really influence how we see our lives and how we interpret the things that happen to us. For example, a person with negative core beliefs, say a student who receives a B+ on a paper, might be really disappointed and feel like that B+ is a failure. Whereas a person with positive core beliefs might see that B+ as a great opportunity, so close to an A, to develop a few more skills and get into that excellent range. Eventually, using CBT, core beliefs can be changed. It does take time and work, but the good thing is that during that time and work, you'll also be learning about new ways to reduce your emotional distress so that you start feeling some relief on your symptoms. CBT operates in a way that's nicely explained using a triangle. So each point on the triangle is represented by an aspect of life, either thoughts, emotions, or actions. So if you can imagine thoughts being at the top, emotions, actions, and then back up to thoughts again. A lot of other providers will use behaviors instead of actions, or feelings instead of emotions. But I like to use the thoughts, emotions, actions because it spells T, and I think that's nicely remembered. So essentially, when one part of the triangle changes, all parts of the triangle change due to their connections. CBT believes that the easiest parts of us that we can change are our thoughts or our actions. That emotions, when we try not to feel something, sometimes we just end up feeling it more. But remember, if it's your emotions that are causing you distress, if you change your thoughts, they're connected to your emotions, so those will also subsequently change. If you change your actions, because those are connected to emotions, they'll also subsequently change. So probably the easiest way to explain this triangle at work is to think of a scenario. So take a moment and imagine yourself walking down a busy street, and across the street you see a friend of yours. And you wave and shout their name, but a curious thing happens. They look straight at you, and then they just walk away. This is what's called a trigger, because it's something that sets off a sequence of events. So again, thinking about that thoughts, emotions, actions triangle, what might be some of the thoughts that you would have in that situation? It's something like, I guess we're not friends anymore. Clearly that person doesn't like me. What did I do to deserve that? Or maybe even, nobody likes me. These are some pretty damaging thoughts, and yet they're understandable given the situation. So let's take one of those, the clearly we're not friends anymore thought. Now if we think about emotion, if you thought that, what might you feel? Possibly some sadness, disappointment, despair, maybe some anger, a sense of grief or loss. A lot of negative things can come out of that we're not friends anymore thought. Now, if you were feeling that disappointment, that sadness, that grief, what might some of your actions be? Well, everybody reacts differently, but some common options might be to go home, turn off your phone, close your computer, and shut yourself out from the world, and maybe crawl into bed, just be upset. Some people might eat unhealthily. Some people might make an angry phone call to that person or send an angry email. The trouble with this thoughts, emotions, actions triangle is that everything's connected and it doesn't stop. So now those actions become the trigger for new automatic thoughts. So let's imagine that you did isolate and you turned off your phone and your computer, so really nobody could reach you. But the fact that you've been alone for a long time because you did that, you might start thinking, nobody cares about me. Now imagine thoughts, emotions, actions just getting more and more negative and upsetting. This is called spiraling, and it's probably a familiar sensation for most people. The good news is that with a CBT intervention, we can hopefully break this spiral before it even really gets going and builds up momentum. So if you remember from the beginning of this explanation, the spot that we want to intervene is either at the thoughts or the actions. They're just easier to change from the start than emotions. So a really common CBT intervention is called thought challenging. So we take that original thought, I guess we're not friends anymore, and we try and decide if it's a fact or not. And the way that we decide if it's a fact or not is we look at evidence. So what's our evidence that we're not friends anymore? Is the truth? Well, I guess it's that they didn't look at you, that they did keep walking, that they appeared to see you. Okay. What's the evidence that that thought may not be true? Since this is a hypothetical scenario, I'll have to make it up, but I'm thinking that it might be something like, I saw them last week and things seemed fine. We haven't had a fight. I still have them on Facebook. If you can find anything that says that thought, that original automatic thought, is not a fact, then we can discard it and we can replace it with a more reasonable one. Now, by more reasonable, I don't mean the opposite. We don't want to trick our brains. This is factual. This is scientific. So a more reasonable thought might be something like, wow, that's weird. My friend didn't wave at me. That seems like a fact. If you had, wow, that's weird that my friend didn't wave at me, you might still feel in the emotions a sense of sadness or disappointment, but it would be at a much lesser degree than that original, clearly we're not friends anymore. And your action then might be something along the lines of giving them a phone call or a text to check in. Or maybe you just go about your day because something strange happened, and strange things happen all the time. So you can see how that negative spiral that started with clearly we're not friends anymore doesn't even take place. So that's just one of the many interventions in CBT, which also involves a lot of goal setting, skill development, looking at your lifestyle, looking at what you do socially and how that can improve your sense of wellness, and reworking those thought patterns so that eventually your core beliefs start changing, which influences that original automatic thought, and it won't be so negatively charged in the future. CBT acknowledges, in fact, it emphasizes that our core beliefs are mistaken, but also that they're not our fault. They are ways that our brain works that were hardwired into us when we were very young, and we've been thinking that way for a long time. So it's been reinforced and we've been trained to think that way. The good news is that even though it's not your fault, you do have the power to change it. So groups through the Mood Disorders Association, CBT groups, usually involve weekly meetings on specific CBT topics. And you'll do things like, it's called psychoeducation, learning about things like how the brain works. But you'll also do some skills development and some group exercises and some discussion. And at times there'll also be some work for you to do at home. That's really important in healing the symptoms of illnesses like anxiety and depression. The time between the meetings, that's when you get to test the stuff that you learn in the classes and see if it applies to your life and make it relevant for you. So I hope this information helps you understand better what CBT is all about. And I really encourage you to call the Mood Disorders Association and enroll in a CBT group, particularly if you're struggling with your mental health in the areas of anxiety and depression. Thank you very much.